Hi, everybody, and we are live with Ron Fitch. Ron is the Chief Administrative Officer for University of Colorado Health, Pikes Peak Regional Hospital. Did I get that right?
You did. Yes, Michael. Thank you.
No, thanks for joining us, Ron. Really appreciate it. I guess I'm a little confused in a good way. Are you the Chief Administrative Officer or are you the Chief Executive Officer? And how does that all kind of work out?
Yeah, sure. So that's a great question. It always amazed me as we were talking just prior to the session starting about, as you transition and you get back into the civilian world, how much emphasis people really put on their titles. They almost put more emphasis on that, I've noticed in some cases, than on their compensation. But the way the system is structured, we're a 12-hospital system in the state of Colorado. And you have your larger, metro hospitals in Denver and Colorado Springs and up in Fort Collins. And then we also have 2 rural hospitals, and Pikes Peak Regional Hospital is one of those. It's actually classified as a critical access hospital that serves a rural community to the west of Colorado Springs. Mm-hmm. And so a lot of the titles, as they look at whether you're a president or you're a chief administrative officer, are based on the number of beds that your hospital has. Mm-hmm. So you become the president of a hospital if you have like 50 beds or more. Critical access hospitals only have up to 25 beds. And so at that level, they just, they classify you as a chief administrative officer. And it's where a lot of people in the healthcare industry start to cut their teeth in leadership roles is at a critical access hospital, because it has everything a larger hospital does, just on a much smaller scale.
Mm. So you're not, when I first, looked at our schedule, I saw chief administrative officer. I was really thinking like a CHRO.
Right.
Like a chief people officer, just dealing with the HR side of the house, but you're really running that hospital for the most part.
I am, yeah, every day. We have a chief nurse that sits beside me, also, Army veteran. So that's great that we have that partnership up here. We have operating rooms and inpatient beds and a very busy emergency department. We engage a lot with the community. I just had a call with county commissioners this morning to talk about COVID-related issues and kind of where we go over the next couple months. Mm-hmm. So now I'm in charge for everything here at the hospital.
And I'm guessing you're a doctor, right?
No, I'm not a doctor. No, I was a special forces officer in the Army.
Okay. So can you? I love it, by the way. And that was a trick question. I knew you weren't a doctor, but can you how did you end up special forces officer to running a hospital, a rural critical care hospital? Can you talk to us about that story?
Sure. Sometimes I wonder that myself when I wake up in the morning, how this all really happened. I will say I've been extremely fortunate in my transition and just lucky. Colorado Springs is a great place to transition. It's a growing community, super, super military friendly. And there's a lot of resources out there in the community for veterans as they go to transition service members. But it's, I started following you when I was in my transition process, and I still do today. And I really appreciate all the wisdom that you put out there. And I always tell people as they embark on that journey to really, if you find Mike Quinn on LinkedIn, and make sure you follow him. But it's networking. That's what it all comes down to. I was able to. But I did my last job in the Army. I was the garrison commander at Fort Carson. And so that does put you in the community. You are the community face. You're out there pitching all the transition programs to local businesses. And when you look at the history of that job, a lot of those folks that preceded me and even after are still here in the community. But it really comes down to networking. I had an engineering degree. It's an expanding health system. They were looking for someone once they became a level 1 trauma center down in Colorado Springs at UCHealth Memorial Central, to really integrate surgeons from the bases, nurses, and medics to really maintain their skills in between deployments. So part of my other job is I serve also as a VP of Operations and Military Affairs for Southern Colorado for UCHealth. Part of those duties was to set up the military training programs that exist today. And so we set up training programs with the Air Force Academy, with Evans Army Hospital at Fort Carson, and then also with Army Special Operations Command, so that the 10th Group 18 Deltas could come into our hospital and rotate through with our trauma team as well.
Oh, wow.
So that was really what got me into the system, between growing and having construction projects and facility maintenance experience, general leadership. That's what really got me in there after I was able to network and meet, just by chance, the CEO of our region. And then once he found out I was going to transition, he's like, well, I'd love to come talk to you. I thought he was going to come talk to me about, working with Evans Army Hospital. But that was not what it was. It was more about, hey, we're looking for someone who can serve in these functions, and do you think you'd be interested in that? And so I was immediately. It was, what a great opportunity, a great organization, great culture, everything that you're looking for. It checked all the boxes.
No, that's fantastic. I mean, was it intentional networking, or was it just really talking over the course of your day at work?
It was really just over the course of the day at work, and by chance, as I was focusing my transition, I have a civil engineering degree, and I was going through a PMP program as part of the transition as well. I thought I would, link up with a construction company, and I had some interest for that. And then it just ended up in a completely different direction. And I couldn't be more thankful. I love it.
Did you finish your PMP certification?
I did all the training. I never did take the test.
I didn't either. So that's why I had to ask. Yeah. So, no, that's fantastic. Okay. So Special Forces officer, garrison commander, networking, run into the regional, CEO for UCHealth. And he kind of has a job opening, you guys chat, and he just brings you right in to run that hospital, or did you do another one?
No, I did an interview, and this was something else I always share with people, locally here as they go to the interview. In the military, you never really have to interview for a job. Maybe if you're going to be an aide or an assistant or something like that, you interview with one person. And so our CEO had started me out with, well, I'm going to send you up to Denver, and I want you to meet our system CEO and our system HR, VP of HR, and a couple other folks that work in governmental affairs. So I did that. And then it was like, okay, now you're going to come down and we're going to set you up for a series. It was a full day experience. I mean, it was all these panel interviews with different levels of the organization, above and below where the role that they were looking at you for fitted. And so just a great experience, but it was not, something I was necessarily prepared for or had experience with. And it was just, maintain that enthusiasm and just continue to prep and prepare for those series of interviews and the questions. And the one that always came up was, well, you're not really from a healthcare background. No, but in Special Forces, because we're so small and so limited, we did extensive medical training. So very familiar with trauma, very familiar with packaging, unfortunately, wounded soldiers and things like that on the battlefield. Extensive training, minor surgical stuff that our 18 Deltas had prepped us for before every deployment. And they were like, oh, wow, that's really interesting. So you really do have to go back and think about, were you a combat lifesaver? What other medical skills or medical training did you participate in? Because every soldier has some type of medical training or experience with a medical facility or healthcare in some manner.
Right. Now, I could see how the additional experience, from your SF background would be relatable. Yep. In a way that they understand. I would also imagine that experience, that adaptability you have being in a Special Forces background probably has been beneficial over this past year, being where you're at, responding to COVID, building new processes, everything else. Would that be a safe assumption?
Yeah, when I look at our organization, and our regional CEO has brought this up a number of times, we have a lot of veterans in leadership. Our chief medical officer is a former Army doc. Our director of radiology and imaging is from the Air Force. Director of respiratory is from the Air Force. Our emergency manager is from the Army. Our director of facilities is from the Navy. And it's just the attitude and the mentality that brought to our incident command as we dealt with COVID over the last 15 months or so. He will say that we are weeks, months ahead of the other regions in our system. His example will be, I just let you guys go because you already have solved problems that at the system they're putting policies or putting committees together to study policies about how they're going to solve something, and we're 3 problems past that already.
I love it. I love it. That's one of the biggest things that I've seen about veterans. And speaking with other C-suite leaders in organizations, I'm starting to see that adaptability has really come to the front. The ability to just see the problem and get to a solution and be flexible to just move that direction, build a plan, execute the plan, change when necessary, because, the best laid plans never survive first contact, and find a way to make things happen and complete the mission. I would think that would be something that would be incredibly valuable in the hospital industry, with everything that you're dealing with, from patients to providers to, my God, even just visitors, right?
No, for sure. You are absolutely correct. And I even told a transitioning a service member yesterday, he's about 9 months out and trying to figure out what he wants to do. He's very interested in healthcare. I said, you have to be an organizational learner. Even in your military career, whether you're an NCO or you're an officer, you're only sticking in a job for so long before you're moving on to something else, a lot of times without any training or experience. And so you have to be able to adapt and learn organizationally how to handle that.
Oh, that's fantastic. Okay, so let's talk about the hospital. Well, first of all, Richard Dixon wants to know if there are skill bridge opportunities with UCHealth.
There are. And we've hired, as I was chatting with Michael before the session started, we're in the process of reviewing hiring our heroes fellowship packets right now, but we've also hosted skill bridge folks too. And several of those had led to employment at the end of it, which was always great.
No, that's fantastic, and thank you. So let's move on to what you actually do.
So every day is truly different. I know that probably a lot of people say that, but there is some standardization to how the day starts off. Every healthcare system and hospital is all built on a culture of safety. Mm-hmm. And so what that means is you're really doing an after-action review of what happened yesterday, what mistakes did we make, what positive things did we do, and then we're highlighting those in the morning. So you have this culture where people aren't afraid to hide maybe something that they did wrong, or if they needed more education. A lot of it's self-reported. And so we start off every day, 10, 15 minutes, just going through those types of things. Sometimes it'll roll into some leadership updates too, between leadership meetings. After that, we took over from COVID as we stood down incident command. Our incident command worked really well. It was super responsive. It was just like I would equate it to when you're back in the garrison, training atmosphere, and everything's bureaucratic and you have to follow these rules and regulations. Then when you deploy, a lot of that's relaxed. You're not doing a lot of that excess training, and things are moving a lot faster. And that's kind of how it was with COVID and incident command. And so we wanted to keep a lot of that momentum as we transition back to normal operations. And I said, boy, I've seen this before. We have to really be deliberate about making that transition, because a lot of times it doesn't happen. You'd be deployed to Afghanistan and be like, oh, we really need to bring a lot of this stuff back to, Fort Bragg or Eglin Air Force Base, and really make these changes so we're not dealing with all this bureaucracy when we get back. It never happened. I think we always dealt with that bureaucracy when we got back. The machine was just too big to change it. And so I brought that up as an example. If we really want to truly make this shift, we need to be very deliberate about it. And really make that cultural change for everyone. And it's worked out great, because people get on-the-spot feedback and they love it, and things are getting fixed. Sometimes it turns into a work order meeting, but people are still seeing results every day about issues that they're bringing up and able to solve. And then we go through and do...
Can I ask what a work order meeting is?
So just like anywhere else, if you had an issue with the barracks, or if you had an issue in your company headquarters or something like that, you're putting in a work order for Department of Public Works to come and address. So it's no different here, right? So you still have facilities issues that need to be addressed. You have IT issues that need to be addressed, and they're all pushed into a work order system. And then, the technicians will come out and they'll respond to it and fix it. So sometimes in the morning during that operational update, it turns into, I didn't get this work order addressed too quickly. Not really the intent, but still you're getting some great feedback from that on the spot. And then we spend about 30 minutes going through operational updates and what's going to take place over the next week or two for each service line or clinical area. Think about it more like a platoon or company within a brigade, so that you understand what they're doing training-wise and operationally and strategically. And so there's no stovepipes that are developed, and you can kind of see, where do I need to pitch in to help my teammate over here to help them be successful.
So you start off your day. What time does that?
So typically I get in here about 7:30, kind of go through some email, looked at what happened overnight in the emergency department and any change to patient status and things like that. And then I do have other responsibilities too in the region for all the facilities maintenance, construction projects, security, and then the military affairs program. So get caught up on anything there that I need to do before we start kind of our hours worth of operational meetings, whether it's the safety operational updates or kind of the stovepipe dissemination, if you will. And then after that, after about 8:30, there's just then a series of meetings that relate to all your different duties or engagement that you need to do with partners across the region to be successful.
So did I hear you say you're also responsible for facilities, security, and for other hospitals within the region?
We have 4 hospitals in our region. So, and then we have a couple medical office buildings and a bunch of clinics. And so, that would encompass all those facilities as well.
So kind of matrix, it's kind of a matrix role. You have your one hospital that you're running, but then you have cross-cutting responsibilities across the region.
Yeah, wow. That's a good way to look at it. Yep.
No, that's fantastic. So I guess, you start at 7:30, you're probably done by about 3:30 in the afternoon and going home and, just relaxing the rest of the day, or?
No. So there's also I would say probably you're working until about 4:35. So it's definitely a longer day.
Yeah.
And there's also a lot of community engagement that takes place. So, in the role that you're in, probably from manager, certainly director and above, our CEO has a expectation that you're going to be on at least a community board, or you're going to be doing some type of community engagement to represent the hospital in the community as well.
So a lot of that happens after hours.
It does happen after hours. Not all of it. A lot of board meetings and things like that do take place during the day. And at the end, the hospital is fine with you attending those things because there is an expectation that we'll be involved in the community.
Right. And I guess that goes right into what Timothy Sharp wants to know is, what professional associations are you associated with?
So I still maintain my engineering license that I had and received while I was in the Army. So I do still participate in the civil engineering, American Society of Civil Engineers. And then I ended up on the on the board of directors for our local Chamber of Commerce. I'm involved with domestic violence advocacy, not-for-profit, that provides services throughout our committee. We also have 2 advocates embedded in our level 1 trauma center emergency department. And then just on a personal note, I also got involved in a little bit of the arts community. So I'm also on the board of the Colorado Springs Conservatory, which is all focused on youth, music, and the arts.
I love it. So with that being said, okay, so we know your day, your general day. What does success look like for you?
Well, that's a great question. Really, I think it's just really still striving to be a servant leader. Come to work. Did I make an impact for somebody today so that they could take care of a patient? We look at our values. Patients are first. So it all comes back to that patient, and are they being properly cared for? Do they have everything that they need? Is the family needs being met? So as long as I can go home every day and say, yes, I made an impact in that realm, I find success there.
Okay, now what about to your boss?
So in that case, it's keeping the projects and things like that on track. So we're in the middle of just getting ready to start 2 more big construction projects. So will those stay on time? Will they stay on budget? Are the physician recruitments aligned to fill out all of those new clinics and surgery centers and things like that? That comes into another partnership with our medical group, which is where all the physicians reside. So as long as we can do that on the facility side, keep everything running and fix everything in a very timely manner so that we don't have a service disruption, again, relating back to taking care of that patient, that's success.
What about, I hate to ask this question, but what about revenue? Are you responsible for revenue as well?
We are at the hospital, yep. So definitely responsible for the The budget at the hospital I run, and then for the budgets of the departments that I oversee. That is true. We're not for profit, but that doesn't mean you don't make a profit. You still have to make a profit in order to pay your employees. And then as a system, we run the only academic medical school in the state. And so a lot of the money that the system generates goes back to running that medical school up at the Anschutz campus at the University of Denver. And then, a lot of our patients their bills are paid by the government, whether it's Medicaid or Medicare. They only pay 60 to 69 cents on the dollar.
Right.
And so a lot of the commercial payers end up offsetting your governmental payers to make everything kind of balance out. It's a really interesting, complex system that you don't really have any realization how it works until you dig into it.
Did your time as a garrison commander help prepare you for that?
With the budgets, certainly, because you got more exposure to it in that. But I think even more so, one of the other interesting transition questions I think a lot of service members get from leadership is, well, people aren't just going to do what you tell them to do, right? So I'm like, well, that was never the way it worked anyways. That's just a perception. In special forces, if you don't have buy-in from your teammates, then forget it. Your stuff will be, packed out into the hall and you can go look for another job. Not that you're not providing the leadership, but you have to build that collaboration and consensus amongst the team. That's just another leadership quality. But even in the garrison, very few soldiers, a couple chaplains. Maybe, we have an NCO who's getting ready to transition out and is filling a billet in Department of Public Works to monitor housing. But you're working with all civilians. And so you're only there for 2 years. They've become experts at waiting you out if they want to and wait for the next guy.
So trying to wait you out.
That's right. So working with Army civilians was also just a great experience and help with that transition.
I love it. It truly teaches you to get stakeholder buy-in.
Oh my gosh, yes.
Unless you're ready to invest a lot of time to put your eyes on somebody and walk them through every barrier, or they'll wait you out. So I definitely can see how that requirement to get stakeholder buy-in, to build a team, and to provide formal and informal leadership really could pay dividends when you get out.
Yeah, it certainly did. That's for sure. We use it every day.
So, biggest transition challenge for you? Like, what was the biggest learning point, the biggest thing that you had to adapt to when you got out?
And so I'd say the big thing, we have a lot of acronyms in the military. Well, so does healthcare, and they're all completely different. So that was probably the biggest challenge. It probably took 6-7 months to really learn a new language, and new acronyms. And so every day you're writing something down and then going back to look it up in a reference somewhere to make sure you understand what it means. That was definitely the biggest one, I think. I can't say enough about my colleagues and the organization I landed in. Again, exceptionally lucky. Such a collaborative environment to bring a new person in and really bring them into the culture and the system and collaborate and teach and mentor. It's been fantastic.
I think they're lucky to have you, responsible for your military veteran affairs, because that's a huge difference to finding our success. My first job, it was like small business, and it was like, boop, you're a director, welcome. And I remember, walking around and like kind of making my job up as I go. I found my own way. I asked questions. I built relationships. That's who I am. But my second job at EY, a much larger consulting firm, you get assigned different types of people to help with your transition. And I had a peer mentor that was outstanding, Jeremy. And I could call him and he would talk me through things that I never had to deal with. And having that supportive system makes a huge difference, because there are a lot of concepts that we don't think about. And a lot of, cultural hurdles that we have to get over, not knowing that we don't walk in and instantly have this anymore, right? You could walk into any room and you start talking with this on your chest, or I could do it, and you have a certain amount of credibility.
Right.
In the private sector, when you walk in, nobody sits at the head of the table. It's very, in many cases, very flat. And you have to kind of build the relationships that are going to make that work. Sorry, I'm interviewing you and I'm talking. Think about that.
No, you're absolutely correct. Those are all great points.
So I guess a good question would be, since you run the military affairs is it for the region or for UCHealth?
It's really focused on the region, but we are moving it and growing programs in the Metro Denver region too, because Buckley Air Force Base is about 2 miles from our main campus up in Aurora, Colorado.
So what do you guys, I guess, from an employee resource group standpoint and from an outward looking, hiring, engagement, supporting transitions, whatever. Can you talk to me a little bit more about what you guys are doing?
Yeah, it's a great question. It's all kind of in growth mode, if you will. It started out with just the focus being on those training programs that I kind of highlighted earlier. But now, especially because those training programs kind of took a backseat during COVID, military didn't really have it, whether the Army or the Air Force, they didn't have anybody to really send. They were dealing with their own healthcare facilities on base. We kind of shut down some student rotations, not med students per se, but some other shadowing and other opportunities. So that stuff kind of got put on pause, and then we started looking at, well, what else can we do? So again, I can't thank some of my colleagues enough. We got a lot of help from one of our folks who does talent management in the system, and she had a big interest in, based on veterans and her family, to kind of help grow the program. So we became a military-friendly organization and got designated as that over the last year. We really got engaged on employer support to the Guard and Reserve and received a number of awards last year on behalf of our Guard and Reserve members. We started up a military spouse work group. We actually just had a meeting with them yesterday because we have a ton of military spouses, and most of them, you don't know who they are because they don't want to necessarily highlight themselves because they think it's still a stigma that, well, if they know I'm only going to be here 2 years, then they're not going to really give me a hard look. We have so many and really embrace the military community here that we want them. We want them to come here because they'll probably come back, and then we want them to come back. And so that, it was funny because they brought up that we want to make sure the other military spouses know this is not an FRG, that this is really focused on a mentoring, peer network, and then really outreach to the local bases by military spouses who work in the organization to recruit other military spouses to come fill some of our vacancies. I think that is going to be a huge boon as we move forward over the next probably 12 months.
I will share that I've hired quite a few military spouses over the last 2 years. I've had to talk them through that fear of not saying they're a military spouse. But when you advertise that you want them, that you value them, and that you're giving them meaningful jobs that, pay fairly well, not trying to take advantage of the fact that they're military spouses, if you build it, they will come. And you will not find a more resourceful, hardworking, loyal group of educated employees out there. And I've truly seen that. And, they faced 24% unemployment before the pandemic.
Yeah, that's right.
Economically disadvantaged group in the United States. And so I'm excited to hear that you guys are incorporating a military spouse initiative into your veteran and military affairs programs. So I guess, we're getting close to the end here. I guess my question would be if a military spouse or a veteran or a service member was interested in coming to work in your region or working at UCHealth, what are the best ways for them to kind of get into that, hiring process?
Yeah, on our hiring page, we just pulled out a whole separate piece, for that cohort or group specifically. So you can go on there and connect and see a lot of the opportunities that we have. It's in flux a little bit still as we continue to build it with the IT and marketing team. But we're putting up all our military-friendly banners. We're planning on doing videos with military spouses who can share their experiences from working at the organization over the last couple of years. But that's all going to be on our page where all of our job openings are.
Is it easy to find some of you? Like, do you have a veteran recruiter or somebody aligned to your veteran military spouse initiatives that they could reach out to? Or
we do. We haven't gotten that far yet, but that's kind of the intent, to build that expertise up.
Okay, great. So they could probably find, like you said, it sounds like there's a lot of veterans in UCHealth.
Tons.
And if they searched on LinkedIn, they could find some veterans on LinkedIn.
Easily. Yeah.
And they'll probably take phone calls in
absolutely
cases. Sounds like it's fantastic. Okay, so 2 questions then. Number 1 tip for a transitioning service member that's looking at getting out, what would you tell them to do?
Start early and network. You get really good. I mean, it's all this. And again, I always put back to what you put out every day, and thank you for taking the time to do that. But it's starting early, 12 months out. It is networking and really doing informational interviews. I mean, I know that's more than 2. But those are the most important things, I think, from what I've experienced and observed.
So, and can you define for me what, like, when you talk about starting early, 12 months out, that's not just going to TAP, right? It's not just clicking all the mandatory things, right?
No, you really have to do some reflection and figure out about what is it that you want to do. I did use the Commit Foundation to help with my transition too. Great organization, and they provide you this book before their session called Designing Your Life. It's written by 2 Stanford professors. Excellent book, easy to read, really makes you think back about what do you want your life to look like after you're out of the military. Do you want to continue to travel a lot and be a consultant or a contractor and just constantly be on the move? Or do you want to be more at home, and do you want to be able to take your kids to school and make sure you're at sporting events and things like that after work or even during the day, have flexibility? And that book was fantastic. It really helped kind of narrow down what types of careers and flexibility within a career you're really looking for.
No, I love it. And I tell people constantly, we don't know what we don't know. And so do that research, start to plan the way forward, but kind of open that aperture and network and have these conversations that might lead to an opportunity. Like, you weren't looking to be a hospital CEO.
No, healthcare was never on my radar.
Right?
No.
But because you're openly networking, building relationships, and I'd like to think that Special Forces background definitely helped with that.
Sure.
Understanding perspectives and how to meet people in the middle. But building relationships can often lead to opportunities if you're not connecting to just get a job.
That's
right?
correct. Yeah.
If you're just networking to get to know people and to learn from them, that's often where I see opportunity comes about. And I'm glad it worked out for you. I'm ready for you to take that next step and run the whole region's hospital. Or, we got some big hospitals here in the DC area if you want to come out here and do those. But no, it's exciting, and you're inspiring for a lot of us out here to go from that Special Forces community direct to a hospital CEO. So thank you.
Well, it wasn't direct. There was definitely, that took some time, and there was definitely hard work along the way, and you still have to perform. Mm-hmm. Every day when you get out, you got to continually be an organizational learner, and you got to perform at the organization because they have choices. And if you're not performing, then you may find yourself outside the organization. That's
a great point. So even though you're able to network and get to that role, make it through the interview process, every day is an interview.
Every day.
Basically, it's at will employment. I didn't even think to add that in as well. So you can't just say you made it. You've got to put in the work and
every day,
or they'll find somebody that will.
Because even here at the end of the day, you're still taking care of people. It's patients first, and we're taking care of those patients, but you have to take care of your staff too, just like you took care of your soldiers or your service members, depending on what service you're in. It's no different.
Yeah. On a budget.
Not a budget. That's right.
Well, Ron, thank you so much for today. This has been amazing. I'll go ahead and this will be on the Higher Military YouTube channel as well. I'll tag you in it. And hopefully people that want to learn more about your field start reaching out to you.
Absolutely. Happy to engage for sure.
All right. Thank you so much and have a great day.
You too, Mike. Thanks.